All right, so it's great to have you here today. Can you give me a quick intro on who you are and what you do at Arterys?
Sure. So Arterys is a company that is focused on using cloud technology and artificial intelligence to make radiology faster and more accurate. So I'm the director of machine learning at Arterys, and one of the ways that we are trying to make radiology more efficient is by adding these two components to the standard radiological workflows. So standard radiological workflows involve sort of older technologies, typically computers sitting within the hospitals without too much computational power, as well as a lot of manual workflows, especially in the context of viewing studies, making measurements on studies, and so on. So at Arterys, as the director of machine learning, I'm overseeing our efforts to automate many, especially the tedious measurements that clinicians perform right now in order to remove these sort of unpleasant tasks from their workflows and also to help increase consistency and accuracy to benefit patients in the end.
Cool. And how did you get involved with this work?
So I have been in medical machine learning for a few years now. I have a PhD from Stanford and previously worked at another company in San Francisco that was focused on ear disease diagnosis. But I first sort of learned the ropes a lot as a postdoc at Stanford and have gone from there to Arterys.
Cool. And in getting people to accept some of these technologies, what do you think are the biggest barriers to try to get people to come to terms with?
I think there are two main issues. One is really focused on the technology, and one is very medicine specific. So in terms of the technology, clinicians and really users of any artificial intelligence technology really need to be convinced that it works well and will improve their workflow. So there are many different pain points of a radiological workflow, as there are in any sort of technology or fields in which artificial intelligence is used, and it's important to make sure that the technologies we're using are really solving a pain point. So by first focusing on automation of measurements, we have really targeted a pain point that we know is very critical to the workflow, because reviewing in our initial product, which is for cardiac MRI, we automate some measurements of the heart. And we know that in the standard cardiac MRI workflow, the measurements, especially to calculate the volume of the ventricles of the heart, are very tedious and can take 30 or 45 minutes to actually do manually. So by doing that automatically and allowing the clinician to view those results and make minor edits, we can significantly speed up that workflow, which translates into them being able to review more cases per day and overall being more efficient. So ensuring that we're actually addressing a pain point is one critical thing. And then in medicine, the other big thing is patient privacy. So there are some very explicit laws about protecting patient privacy in the US and in Europe and in other countries, as well as the hospital's reputations are at stake if any of their partners fail to protect patient privacy. So we have focused very hard on making sure that patient privacy is protected and is at the forefront of our technologies. We actually have a system which we call the PHI service. PHI is Protected Health Information. And when we have clinicians upload data to our service, which can be done automatically through their hospital IT system, we actually remove patient information at the hospital before we store the images in our cloud, which is based on AWS right now. And that means that we never store the patient information on our cloud, and then when users use our platform, they actually make two connections through the network, one to their hospital to get the patient information, and one to our cloud on AWS to get the image data, and we synthesize those in the browser, which means that they have access to the patient information without the patient information ever actually residing on our services. So those two things, solving the pain point and patient privacy, are two of the biggest challenges that we've worked pretty hard to address.
Yeah, great. So in sticking with the issue of privacy and kind of removing some of those identifying information, how do you still make sure that you're not including any kind of bias in your algorithms because you might not have some of that patient information that would tell you where those images are coming from?
That's a great question. So I think there are different types of algorithms that are more or less susceptible to bias and are susceptible in different ways. So these initial algorithms we've worked on, which are focused on patient measurement, are very image-based algorithms. And when a radiologist, for example, is performing these measurements, they typically don't need to know the patient information because the information for making measurements is all contained within the pixel data of the images. So to make sure that the algorithms are diverse and work on a patient population that is diverse, we need to ensure that the training data that we have for the algorithms is representative of patient populations. So that's something we initially focus on when training the algorithms, and then on an ongoing basis, because we are a cloud-based platform, all of the data actually does come into our platform that we operate on, and when the clinicians are using it, that's all hosted on our platform, which means that we can learn from that data on an ongoing basis, subject to FDA guidelines, and update models in accordance with how our users are actually using our platform, which allows, say, hospitals that serve underrepresented minority populations to still get the benefits of algorithms, even if they weren't initially trained on those populations, by virtue of the algorithms continuing to learn using that clinic's data. And then there are other sort of more advanced algorithms, especially in terms of predicting outcomes of patients with response to certain therapies, where it is a lot more important to be able to synthesize that electronic health record data, the demographic data, and so on. And those are fields that we don't have any products in right now, that we're thinking about more, and that we definitely need to have an eye on, making sure that algorithms we develop are sort of as unbiased as possible.
Yeah. So in looking at that future work, where do you see the future going for the field and for Arterys?
So I think that measurement automation is a great first step, and it's our first step that we've made here, and I think it's going to be here to stay, because it's so easy to justify, both from a sales perspective, because we're saving time, as well as it doesn't need any patient information beyond the pixel data, which in the US is not considered protected health information. So there are sort of minimal concerns about patient privacy as long as the data is de-identified before you use it, and the benefits are very tangible to clinicians. So I think that's going to be a very important use case for artificial intelligence now and in the future. But then beyond that application, certainly predicting outcomes for patients, synthesizing data not only from radiology but also from other data sources, including pathology, electronic health records, genomic data, survey type data from patients, is going to be really important. And the biggest challenge there, I think we have technology to sort of address all of those different pieces in isolation, and one of the biggest challenges is going to be synthesizing that data into some system that can intelligently ingest it and use it together as a whole.
Yeah, great. So in thinking about where your career is going and where the field is going, would you at this point advise someone to kind of jump into the field of AI, and what kind of pros and cons do you see?
So the con is a minor one, which is like any new field, it does require a little bit of training. There are a few aspects. There is understanding the tools and knowing how to use them, understanding some aspects of the scientific method, and then knowing sort of how experiments are typically performed, because there's a lot of nuances to doing this that can be a little bit tricky, but with experience those all come for sure. But the pros, the upside is huge. And I think as a hiring manager for my team, I've personally felt the pain of trying to hire AI researchers, and at least where I work in San Francisco, it's extremely difficult. It's very competitive. And the competitive, what's my disadvantage? The competitive labor market is a huge advantage for individuals who want to work in that field, because there's a huge demand that's not going to be filled for decades probably. So there are many, many companies doing a lot of different interesting things in medicine, in autonomous vehicles, and all sorts of other categories. And I think this is a great time to get into the field, because the demand is huge and it's only going to grow.
And if one of those potential hires is watching right now, how can they get a hold of you or Arterys?
How can they contact me?
Yes.
Okay. Well, you can always contact me by email at dan@arterys.com. I read all my emails and I'm happy to respond to them. And sure, we'll have to get in touch.
Cool.